they were not afraid of either the bed or switching off the lights. It is not just a fear. You find out where is the fear coming from. Okay. I'm done with that. Done.
Okay.
Oh, and one more. Sorry.
Okay.
A lot of crying, excess crying and screaming is a show of negative emotions and irritability all the time. You know, they can cry over food, but excess crying for like an hour is excessive. So that means something else, which you have to find
One
out.
question, Tina. When I'm looking at these characteristics, at what age? Is it? Does it mean it's at any age? Ama ikona a significant age I should be looking at it?
Of course, it's we can segment it into different ages, where some of the traits which I've said obviously will go for toddlers, but you know, a child is anyone in the ages of 0 to 18, regardless of whatever classification you may know, but this one is appropriate in the sense that they're not independent. So now you can classify the others in terms of, there are those that will affect teens in terms of fears, anxiety, clinging on the caretaker, and so on. And there are those others that will affect the middle child in terms of also the fears, inappropriate skills in learning, incompetence, just basically incompetence even in social life. But for the toddlers, it will be anything that has to do with nightmares, crying and screaming, and also recreating the trauma in their play.
I'm asking that question because I know when I joined Form 1, I did a lot of bedwetting, so I'm asking to understand. Hey, I might have been going through child trauma. I didn't even know. Just hold it there. I've seen Mr. Njenga is in the meeting. Mr. Njenga, kindly confirm. You can unmute your mic. Mr. Sammy?
Can you hear me, please?
Yes, we can hear you, Mwalimu.
Oh, thank you. Sorry for getting in late.
It's okay.
I had issues in my internet.
Okay.
And so I'm very sorry about that.
Okay, no problem.
Yes.
Karibu sana. We are just in the middle of getting to understand what child trauma is. Maybe just say a word, just introduce yourself, who you are, what you do, your profession, and then we can continue.
Okay, thank you so much. My name is Sammy Njenga, and I am a teacher by profession. I teach in Nakuru town. I am married with grown-up children now, who are now in college, and my wife is with me, and I also have been teaching in high school for a long time, now close to 30 years teaching in high school. I've been doing Christian ministries through the Kenya Students Christian Fellowship and others, and so much. I've written a few books, and maybe we'll get to know more as we get along. Now that I'm joining late.
Okay,
thank you, Dan.
Asante sana. Karibu sana mwalimu. So Tina, back to you. Are these characteristics that you have explained to us, are they life-lasting?
Your microphone is off.
Okay, thank you, Tina, Pole. I'm asking the characteristics you've given, the traits you've given us, are they life-lasting? How long do they go? As one grows up, as one matures, will they fall away? one has to work on them?
Okay, thank you, Dan, for the question. Well, once a person goes through a traumatic event, the effects of trauma can be long-lasting, in the sense that in future they develop to more symptoms. It's more like you're graduating now to more symptoms, where you have perceived fears. Nothing has happened yet, but you perceive things as fearful, or you perceive things to be fearful, or you perceive that things are going to be fearful all the time. And this is in relation to the trauma you went through. Okay.
Okay.
Maybe, maybe to give an example, you mentioned something about bedwetting. When a person is exposed to something new and they had been bedwetting before as a child, when they are stressed or when they are going through difficult times, it's more likely that it may recur again, because they have not gone through healing, one, and secondly is because they don't have the skills yet to control this event which has been happening in their life. So there are two possibilities. One is to get healing through therapy, of course, and the earlier the better. And I think that's why we're looking at childhood trauma, saying if you are you see a child is traumatized, or you know that they have gone through trauma, either personal or just general war, killings around and all that, it's good for you to get help for them fast. As a young adult or as a teen, if you have gone through trauma, I think self-awareness is very important. Like, I went through this event, so you also need healing, in the sense that if you do not, then you develop what we call PTSD in future, the post-traumatic stress disorder. Any trigger that comes close to you, it brings now the events and the past events, the past traumatic events, to be specific, and all the symptoms that accompanied the event. So you end up becoming a very unhealthy adult. And bad enough, if you become a parent, you can see now you become a parent who is going through trauma, and you subject your children through trauma as well.
Okay, thank you, Tina. Let me pose this question to Mr. Sammy. Mr. Sammy, what is a child trauma from your point of view? And as you answer that, maybe you can tell us then what is the effect of child trauma, especially to teenagers, because you have been with teenagers. What is the effects of child trauma on teenagers?
Thank you so much. I hope you can hear me.
Yes, I can. We can hear you.
Oh, thank you. Now, trauma is an emotional response that comes to a child because the child has undergone terrible events in life, or things that are very difficult, so that the child is not able to cope psychologically with what has happened. And so the child is not able to cope psychologically and emotionally because of what has happened. And so the child develops issues of response that are not normal. The child will not behave in a normal way. The child will not be able to deal with life in a normal way because of maybe one or two experiences that the child has gone through. And in my experience with teenagers, there are children that have gone through trauma, especially because of things that happen at home. Could be poor parenting, and some of the children are brought up by house helps or house managers that do not treat them well. And so the child may end up developing some kind of phobia, some kind of unhealthy relations or strained relations with the house help. Some of them have been sexually molested. I've dealt with cases of children who have been quarreled too much, and the too much quarreling, either it is from the parent or from maybe a teacher in school or somebody that they should be relating very well with, and too much quarreling also may lead to the child developing defensiveness and fears in life. That is excessive fears. There are children that have gone through trauma because of being taken to school too early. Too early. These days, children are taken to school too early. They are removed from their parents. They are removed from their mothers. They are taken to school too early, and then in school maybe they are bullied. And once they are bullied, then they develop negative emotions, and so they are not able to cope, and they start developing fears even to go to school. And so there are a few things that I would mention, but maybe for the high schoolers and the teenagers, I found that there are children who have been bullied in school and they don't like school at all. And because of that, they become traumatized. Every time they think about will go to that school, they respond negatively because of too much of that. There are children also that have not been brought up by their real parents, and maybe I have counseled with students who have been taken through the OCAT. They've been taken to Wachawi and so on, and so they develop a lot of phobia for many things. They develop a lot of phobia for church. They develop a lot of phobia for anything religious because of the kind of either cultic or occult activities that they have gone through, and so they are not able to cope. There are children that confess that even when they were very young, very, very young, even at the age of 5 years, or even in lower primary, lower grades, they are taken through occultic activities, and such a child develops a very negative attitude towards everything, and they act like shockwaves when they hear certain things. And so there are so many unpleasant activities that children go through, and they are not able to cope in life because of their poor emotional upbringing of the children. So maybe just to mention a few, those are some of the things that I think I've seen. And there are children who even refuse school completely. They don't want to do anything to do with school. There are some that there are games they play. There are children who have games they play with their friends. Wanaita mchongo ano, and it may get to high levels of mchongo ano that the child feels bullied, and they start developing negative emotions. They start thinking that their play groups are wrong, and so they start developing very negative emotions about that. There are children that have been cyberbullied, and cyberbullying and cyber games sometimes have gone to very depressive situations or states that may even lead to sickness and terrible sicknesses, some leading to death. And so there are issues to do with the internet, exposure to so much internet, exposure to some violent games and violent media. It may also cause a lot of trauma to children that I have experienced. Maybe I could stop there for now.
Yes, thank you for that. I want to just push this question to Tina, but before that, if you have any question, please just drop it on the chat icon, Hapo, and then one of our leaders is going to take us through the Q&A session. If you have any question, you want to verbalize it, please just drop it at the chat icon. I want to ask Tina, is there a moment where a child has gone through child trauma but is not able to express it, in that there are many characteristics we have said of how this child will behave. Are there times that this child is not able to verbalize it, is able to probably suppress it emotionally, so hatuwezi jua? Is there a moment like that?
Yeah, there are moments like those, in the sense that, kids can just fear adults even without them doing anything. And worst of all is if they verbalize maybe an outcome and say, if you tell anyone I'm going to do this to you, so they won't tell. And because they are not telling, they will engage in some behaviors which are not normal, just to communicate that things are not okay. One is isolation. They'll just be isolated, not make friends, not want to be near people. They can engage in self-harming behaviors, drug use, cutting, any emotional torture, even eating disorders. That's why, you just can't take anything for granted coming from anyone in the age below 18 is an expression of something. Others become sexually active because either the trauma was sexual oriented or the trauma was on the body. Now they hate their bodies so much, they just want to hurt their bodies in that way. Others take too many risks, drug use, running away from school, running away from home, sleep disturbances. Yeah, they will not want to sleep at all, either because they are afraid whatever happened may happen again, or just show basically changes in behavior. In the way that you know them, they'll be totally different. In the sense that maybe if you know them to be a charming person, they can look depressed, or they can appear as depressed and withdrawn. So changes like that, just to indicate something is wrong with me, but I'm not in a position to tell you. Though I may want to tell you, I may not be in a position to tell you. Back to you, Dan.
Oh, okay. Tina, then you'll help us understand. Is there any difference between, and what is the relationship between child trauma and depression? Is there any relations? Are they the same? Are they different? If they're different, is there any relationship between child trauma and depression?
Okay, so in my definition, in the first attempt where we started, we defined trauma as a negative experience that happens to a person, a scary experience that happens to a person. But the reaction to this experience is what now can be termed as post-traumatic stress disorder, a reaction to a traumatic event, or it can even give birth to depression, of which depression is excessive negative moods which become dysfunctional to a person. So let's take, for instance, crying, where a child has had a traumatic event like bullying in school, and they have not had an opportunity to speak about it or to tell it to an adult who can help them heal from it, or even deal with it. So they resort to crying. Every time they remember the event, they're just crying. So the crying, if it is for a long period of time, let's say if they're crying for like 2 weeks, they're still crying about the same thing, it will now give birth to other negative emotions like mood, being moody all the time, negative moods, irritability, and all that. Then it is a reaction to the trauma, the event itself. The event is the trauma. And then the reaction to the event is what can lead to either depression or PTSD, post-traumatic stress disorder, and many other, even dysfunctional behaviors like I've just highlighted.
Okay. Thank you for that. So the event is traumatic, is a trauma, but the reaction is what will maybe lead to depression.
Yes, that is true.
I've got it correct. Now, I want to pose this question to Mr. Njenga. The African parent I am, when we were in school, there are those children or students who wanted to just transfer from the institution. Wanataka tu kuhama. Me next time sikuji. And probably as a parent, you will push the child to continue studying there. Now, how do I tell that the difference between the reaction of my son or my daughter about an environment, the reaction about this house girl, the reaction about that school? Now, how do I tell the difference between that? Because we always say when one is in the teenage age, it's kind of confusing to actually understand them and understand whether they are true or they are lying. So how do I tell that my teenage daughter is actually probably undergoing through trauma in this institution, other than anataka tu kuhama, anataka tu kujiona ako karibu na nyumbani, hataki huyo auntie, hataki yule house girl? How do I tell the difference?
Thank you so much. I think teenagers are very complex people to deal with. And for a parent who is bringing up teenagers, it's very important to keep close to your child and to keep close the child so that you are able to understand that child. And once you're able to understand the child early enough, then you are able to become friends, and the child may be able to open up to you and tell you that I don't like school because of A, B, C, D. They may tell you they don't like school because of maybe teacher X. They may not like school because of some experience that they have undergone. And so I think majorly I would say that it is not very easy to detect, but you could involve even the school teachers that teach your daughter or your boy. You could involve the friends that are in school so that you are able to dig out and find out why is the child refusing to go to school? Why is the child wanting to transfer? And basically, in my view, it's an issue of relationship. What kind of relationship have you built with your son, with your daughter? And if you have a good relationship, then maybe your son or your daughter may be able to tell you, this is what is causing me to take this step, or this is why I don't like this school, or this is why I would want to transfer. And so basically, I would think that it's important for a parent to build a relationship with the child early enough, probably before the child gets even to teenage, so that the child is able to open up. However, I would confess that sometimes it is not very easy to tell a child who is just truant or a child who has issues in school and would want to leave the school for another school. And so it all depends on the relationship that you have built with a child. And if you don't have that relationship, I think it is important to involve the teacher in class, maybe the class teacher, maybe try to find out from in schools we have department of counseling and guidance. And so if you're able to go through that, I think a parent can be helped. Thank you.
Okay, before you just go, kuna swali inaulizwa hapo, what's the difference between trauma and stress? Is there any difference between trauma, stress, and depression?
Now, trauma is an excessive thing, excessive emotion. Something very terrible has happened, and the child is emotionally not able to cope. That's, I think, the way I would put it. Something very scaring, something very traumatic, something very terrible that causes a child to get afraid and to feel very scared and things like that. But when you talk about stress, we have even positive and negative stress. And stress is an emotion that comes out of the experiences we go through life. Some of them which we are not able to cope, or maybe the way we respond to issues. If something is overwhelming or an experience is overwhelming, we say it is stressing, I think, in normal terms. But when you talk about depression, again, depression is a form of sickness that somebody has not been able to manage stress, somebody has not been able to manage trauma, and therefore the person becomes depressed. And depression is a state of a psychological sickness where now the person involved or the victim is not able to cope at all, and it now moves from being psychological to physical, and even sometimes even showing clinical signs of sickness. And so it's like there are different levels, but trauma is quite different because trauma is a terrible event somebody has gone through. Of course, that trauma is going to cause some stress, which can either be managed or not managed. If the trauma is not managed, then it would lead to depression.
Okay. Let me just pose this question back to Tina. Tina, is there any moment when we are speaking about depression, child trauma, we expect that anyone who has undergone through these events will be so quiet, will be so low, hatakuwa na psyche ya maisha. The social life is a bit kind of arrested kidogo. Is there any moment when probably you can find someone who has undergone through child trauma and depression and is all way out? He or she is so outgoing, so talkative, so social, and probably that's a way of hiding, whatever she or he has gone through. Can we have a moment like those?
Yeah, we can have the two extremes because people react to shock in a different way. And maybe, it's just a play of words, whether shocking or traumatizing or scary event, anything that wasn't expected, even for anyone else. You can lose your phone today, you didn't expect it, and you decide, okay, I'm not going to cry over it. Or you can decide otherwise, I'm going to cry over it. It's still the same thing. So, and it depends on people's personality. It depends on other experiences that probably a person has gone through. But the underlying fact that there's something that you haven't dealt with will always come out in some clinical or observable ways. I think maybe the counselors who could be in here, you know what I'm saying, in that even if the person is, as you're saying, akona psyche ya maisha, the psyche could be an overdue, meaning that there's something which has not been dealt with. Yeah. Okay. But then the very normal experience or the normal expression of a person who has gone through trauma is just the other side, which is obvious, the stress, the trauma, and the trauma triggers or the traumatizing, the PTSD, let me just call it that way, or even depression. That is more obvious. Yeah.
Oh, okay. The first time I ever heard of PTSD,
and
I thought is
on mute.
Oh, sorry. I'm saying the first time I heard about PTSD, I thought ni akijeshi, ni the army guys, they go fight and they come back. So I'm shocked to see that today it's there. Final question on that point. Would there be a moment where a child has been going through some incidences that brought child trauma, but in this sense, maybe she or he was engaged in some sexual activities at a young age. They didn't know what was going on, but later on, it just causes some form of stress and depression. Is there any moment like those ones?
Yeah. As you said, and going back to where I began, a child doesn't know a terrifying experience and a good experience. They are that innocent. And so if they've been going through maybe sexual abuse and they come to learn about it later in life, now that they are grown, let's just say in late childhood, they come to learn there's abuse and this is how abuse is like, they'll be definitely traumatized. Or yeah, because that's the age where sex education becomes apparent, and they're also discussing among themselves what is abuse, what is sexual abuse, what is rape, and all that. So yeah, they come to learn about it later in life, and they're like, oh, so I went through this. They're traumatizing, they're anchored and all that. So with self-knowledge and of course with increased knowledge and age, it will be like a trigger. It will manifest as a trigger to what they didn't know happened to them.
Okay, thank you. Please, if you have any question, drop it on the chat icon. One of us will go through the questions, and then we'll have that moment to, the Q&A moment. Mr. Sammy, this parent who has undergone through child trauma, kitambo sana, but never healed from the whole issue, and probably the relationship between the parent and the children is still affected by what the parent went through. How do I mend my relationship as a parent to that of a child to get to that point where you said it's all about relationships? How do I go about it as a parent?
Sorry, can you come again? I have not really got your question very clearly.
Okay, I'm asking, so there is this child who is kind of withdrawn, doesn't want to talk, is too much into games, and probably you realize they have been going through some issues as young as they are. And as a parent, you want to get back to that position of parent, daughter, parent, son relationship. How do I mend it that this young man, this young boy, this young girl feels so open to me as a parent? Probably as a teenager, any teenager sahi. So how do I mend that relationship as a parent, just to make sure that now my children are open to me?
Okay, thank you so much. I think I get what you're asking. And now that will mean that the parent will need to accept to have a journey of life with the child because there is so much that is lost. And because of the time that is lost and the relationship that is lost, this parent will need to do a recap with the child. And that would probably mean that this parent will need to now start a new journey of familiarization. The parent may want to now start establishing, just like any other person establishes a relationship, and that may probably cause the parent to start a journey of confession, going back to history and letting the child know that this is what has happened in the past, and these are the effects that have affected, or this is the way our relationship has been affected in one way or the other. And then of course now taking the child through the journey so that the child comes to a point where they can either appreciate that maybe what I have gone through because of ABCD, and they are either able to appreciate that or not appreciate. But it is going to be the parent who now takes the active point, or the active part of approaching the child and wanting the child to appreciate. You have gone through ABCD, maybe explaining, the parent would need to explain that this happened because of ABCD, and maybe at this point I was ignorant, or at this point the parent would confess, a parent making some confession to the child and accepting to be vulnerable, so that the child can see that maybe what the child has suffered is not something that the parent enjoyed, not something that the parent did because the parent wanted the child to suffer. And so if the parent would probably take that approach of humbling themselves and letting the child go through history with the child, explain to the child the things that have happened and the reason that they happened in that sense and where they are at now, and even now express the interest of that from now we would want to mend what went wrong. We would want to do repairs. We would want to begin afresh. We would want to have and offer that child some hope, so that the child does not see like all is lost and all that is left is lamenting and regretting and so on. So I think the parent would need to do something very deliberate of correcting the wrongs, whether the wrongs were done by the parent or by somebody else. I think any cause of pain or any cause of negative feelings that the child may have may be corrected by going back. And that would mean that the parent becomes bold enough to tell the truth that the parent is aware of, telling the truth and trying to show this young man or this child that I am willing to help you, I am willing to work with you, I am willing to help you live a better life. And of course, the child would know whether the parent is genuinely speaking or not, because children are also very intelligent.
Okay, before we let you go on that point, thank you for that. I want to ask, especially as a teacher, this will be the best question, and you'll be the best person to answer this. A thorough beating, can it lead a child to a traumatic experience? In that, I had an experience of a parent who was explaining something happened in the neighborhood where this kid will go to school, leo amepoteza kalamu, leo amepoteza kitabu. When he comes home, he's given a beating. Akienda kesho amepoteza tena, kesho mama anaongeza gauge juu ni kama haingii. Then at the end of it all, the mother ended burning this kid with a hot pasi kwa kizungu, anyway, pasi. Now, can a beating cause a traumatic experience? A beating from a parent? And if that's the case, now how do I gauge my punishment or my as I correct my children, showing them the way? Do I use the rod, and for what is the threshold?
Okay, thank you so much for that question. It's very important because one of the causes of child trauma may be that kind of uncontrolled beating or uncontrolled, unreasonable punishment. And that is usually done out of anger, that maybe the parent is too angry and they are losing themselves, they are losing self-control. And because of lack of self-control, then they go to punitive punishment. And punitive punishment does not help the child, because anytime the child is being beaten, and especially the children of today, they are children that will just see a cane or whatever is being used to inflict pain. They just see a cane and they become wild. Some of them start crying uncontrollably and so on. And therefore, the issue of beating of children should be taken with a lot of care, with a lot of self-control, and have corrective punishment. And corrective punishment sometimes does not need a cane. You may just need to show the child that this thing you did was wrong, and because it is wrong, then you sit like you sit on a negotiation table. First of all, you want the child to realize that what the child did was wrong, and they accept it was wrong. And then you sort of negotiate with the child that now that you've done this and you agree it is wrong, then I have these forms of punishment. Sometimes you can even offer, choices that either you're not going to watch television, you are not going to go out, you are not going to do, some choices of some forms of punishment. Of course, even withdrawal of something that the child loves so much, maybe it could be entertainment, it could be going out to play with friends. That may be the form of punishment, so that the aim becomes correcting the child, but not necessarily inflicting pain. But on the other hand, I would also want to say that there are times when using the cane is important. Using the cane is important, or inflicting some pain, but the pain should be controlled, or the pain actually should not be, a parent should not inflict pain on a child when they are outrageous, they are angry, they have outbursts of wrath, and sometimes they even speak very bad words to the child as they do the punishment. And therefore it is very important for a parent to be sober when they are punishing their child. And like I have said, or I would want to summarize and say that even as much as we're saying that there could be that kind of talking and negotiating with the child, it is also important to know that there are times when using of the rod is very important. Using the rod is very important so that the child can learn and associate, the cane with correction and so on. But total withdrawal, the cane is not advisable from where I sit. There are times when the child will only understand some inflicting of the pain so that they can learn. I have seen, for example, children that cry. They are crying for the phone of the parent. And because they are crying for the phone of the parent, they will do anything. They will get angry. They will get into rage because they want the parent's phone. And in that case, if the parent volunteers and gives the phone out to the child, that is poor training for the child. And therefore, a child should be able to be trained early enough that if it is daddy's phone, that is a no-go zone. If it is mommy's zone, that is a no-go zone. And that should be done early enough. I have seen children who even are less than 1 year old, and if you train the child through inflicting some pain, there is what is called conditioning, inflicting some pain because of some unnecessary action that the child is doing, then the child now learns that when I do this, some pain is inflicted, and so the child withdraws. And so it all calls for wisdom to know when are you supposed to apply the cane, when are you supposed to talk to the child, and together with that also goes the issue of training the child, because the child can be trained early enough. And when the child is trained early enough, when they grow up knowing that this is right, this is wrong, mommy doesn't like this, daddy likes this, if you do this, these are the consequences. And therefore, I think it is important for us to know that all those forms of discipline or correction, because discipline mainly means training, it means correction, means bringing up somebody in the right way, means teaching and instructing in the right way. And so we should not just take discipline as an issue of taking the cane and inflicting pain. Thank you.
Okay, thank you sana Mwalimu. Back to Tina. Tina, kindly elaborate for us, help us to understand. There is a point that Mwalimu said that at times taking kids to school at an early age might cause child trauma at several instances. What's your take on that?
It's quite interesting for me because I'm the one of those kids who went to school very early, below the age that was accepted, and I still went to school anyway. The trauma was that after I was accepted now in class 1 at age 4, the same school I really wanted to go to, I started to refuse to go to school sometimes, because I would find something strange, either the friends or even the food, sometimes even the washrooms were traumatizing for me. And the following day I would say, I'm not going to school. And, I'd not developed the social skills or even the competences I may have been bright. I learned how to read early. I may have been bright then, but I didn't have the other competences that would make me fit in a school environment. And because this is a new environment, it comes with its own shocking experiences that you are not prepared for. And that is why the age control is very important, such that by the time the child is going to class 1, they have developed intelligence in all other areas, how to navigate friends, how to navigate a new environment, and every other thing that is expected for them to do. Then they would sail properly, in the way that is expected of them.
Okay. So you experienced child trauma hata kama ni kapase kadogo tu?
Yeah, because going back home, my mom would not allow me to sit there because I was crying every day to go to school, and her word was, you have to go back to school. So I went back to school, and I would feign sicknesses here and there, and I'm just in class 1. I would go to the teacher. I say, I finished my work, now let me go home. And it's only we have not even reached break. We are half the morning session, and it was a roller coaster there. And I had to learn the hard way that when I go to school, I have to wait till the school hours are over, then I can come back home. And that extended for a period of time, close to even months, before I even, adjusted properly into the system.
Okay, beautiful.
Yeah.
Final question on that point, so that we can close our session and probably go to our Q&A. As an African parent as I am, is it advisable to tell my kids when I'm wrong? Hey, Brayo, najua jana nilikutandika vibaya. As an African parent.
I echo the words of Mr. Sammy, the approach that he has taken. It's unfortunate that in our African setup, we don't learn how to be a parent. You just get to the point where you are a parent, and because you don't have information and you lack knowledge so much, you replicate 100% what you saw in your home or what you saw your father doing. And that is how we are having this society where all people are traumatized by one event that happened in their home or that happened to them personally, either coming from the parent or so. So if we take an approach of learning, yes, I would say it's in order to apologize even to your child when you wrong them, to even just say sorry, because how else would they know that you're also a human being like them? And the other side of, the parent not apologizing and not saying anything makes the child see their parent as a demigod who is always right, and or who is to be feared, or who is to be, anytime they say something, you just say away, or a person who is never friendly. And so that is going to now bring in the other cycle of them replicating the same. My say is final. And there are good things you can learn from your kids as well. And the interaction, you seeing yourself in another form, that these are your genes. Yeah, the person has inherited something from you. I think it's a lovely thing.
Oh, okay. Hey, I'll have to learn the whole process. I'm sorry, nilikutandika vibaya jana. It's a process. I want us to please, before you call it off, how as a parent, how do we ensure that we raise our kids free from child trauma and depression? What is the key?
Personally, to the extreme of gentle parenting, where you have an agreement with the child, they know what they're expected to do and how they're expected to do it, and if they do not do it, what are the consequences, and to use the rod sparingly, only when it is necessary to do it, because even the Bible says, train a child in the ways that they should walk in. And part of training is also teaching, coming to an understanding and making the rules that you have set for your child very clear so that they know what they're supposed to do. I've also read, when I was preparing for this, Colossians, the book of Colossians, chapter 3, verse 21. And it says that fathers do not provoke or irritate your children. That's a different version from NIV. It says that fathers do not provoke your children. And I believe we all know that verse. And I was looking into what is provoking. And the commentary I read, it was showing that provoking means giving demands that are trivial, unreasonable, humiliating your children, using abusive words, favoritism, or even being indifferent, and then treating them tenderly and doing kindness. And I was stuck here on the treating them tenderly and with loving kindness, because if you do not treat them in this way, they will lose heart and become discouraged and motivated, which is a broken spirit. And a simple interpretation of a broken spirit is simply depression. You see that? And I stand firm on the words of one of my lecturers. He said this, that if you want to learn to be a good parent, you can practice the 3 F's of parenting, where you are firm, you are fun, and you are friendly. And to top it up, I would say, if you would use the rod sparingly, then you would train more. And that means you'll have room to have friendship. This is also a human being like you. And I don't believe that even in our own adult engagements, when a person wrongs to you, the first thing you run to is a stick. You negotiate so that you can have an understanding. And if you can take the same concepts and apply them to a little person who is looking up to you for knowledge and advice, I think it will go far. Back to you, Dan. Thank you.
Okay, thank you. I want to pose probably one of the last questions to Mr. Njenga. Now, this young woman has realized probably he went through child trauma. Where do I start the healing process?
Thank you so much. Now that the child has gone through trauma, now there are many ways that the child can be helped. And I believe the child is a human being, and a human being has a brain, and so the child is thinking. The human being has emotions. The human being has a soul, he has a body, and so on. And so the kind of approach for this child to be healed, I think, needs to be wholesome, so that you don't just help the child maybe physically or clinically, and you ignore the emotions, you ignore other areas. And so we are supposed to maybe aim at producing the whole person or dealing with the whole person. And one of the ways that I have personally been able to help young children, rather teenagers who have been traumatized, is taking them through a spiritual experience. Take them through a spiritual experience. Number one, this child is shown love, unconditional love, and value. Show that child that the child is valuable in your eyes. Even before you talk about other things, you befriend the child. You talk to the child in a friendly way. you try to remove animosity. Maybe the child is used to punishment, used to harsh words, used to, all that unfriendly environment. And so the first thing is creating a friendly environment to this child so that the child can first of all feel acceptable. Once the child feels acceptable and loved, then it is very easy to penetrate in the life of that child and in the heart of that child, and thereby helping that child. But before you can show that child that the child is valuable, maybe they have come to a point of thinking that they are useless. They have come to a point of thinking that maybe nobody loves me, nobody cares for me. And especially teenagers have a lot of that tendency of thinking, making judgments that nobody cares for me, nobody loves me, nobody is interested in me, and they start self-hate. And once they are there, the only way that you can be able to build up the esteem of that child is showing them unconditional love, bringing them close to you, and finding out what is going through their mind and what they are thinking about, especially about themselves and about other people, because some of them have gone to an extent of thinking that everybody hates me, everybody does not like me, everybody talks about me negatively. And so because of what they have gone through, then they have developed a lot of self-hate, low self-esteem. And because all this is this child and the teenager is a reasonable, is a spiritual being, it is important for us to bring that child back with unconditional love, try to treat them well, try to introduce them to to yourself as a kind person who is showing genuine concern. And like I said earlier, they are very intelligent. They can know whether you are showing genuine concern for them or not. And once I bring the child close to me, and we have now developed some form of formal relationship, and I have assessed that the child is appreciating that I am showing love for that child, and the child is building up proper emotions, then at that point I introduce the aspect of godliness. I introduce the aspect of the gospel to that child, because all said and done, I think God is the greatest healer. He is the one who is able to heal bruised hearts. As we may not see so much of what is happening inside that child, but now introducing the aspect of the gospel and God's love to that child, and showing them that they have a father who cares for them. There is a father who loves them in heaven. That way the child may be reformed. And I believe in the transformation of the heart. Transformation of the heart may bring total healing to this child if we're going to take it that way. And maybe mentioning something that Tina has talked about, when we talk about a proper parenting. Now, there are parents who are dictators, total dictators, and they just say, in this house, nobody does A, B, C, D. And if they be that, then if you become a dictating parent, you are not explaining even the rules that you are setting in the house. If you have rules, I believe the best way of implementing rules is explaining that this is why the rules are there. And if the rules are broken, these are the consequences. But so much explaining what are the benefits of obedience, what are the benefits of us working together, because without working together, then the family may not be able to be in harmony. Thank you.
Okay, thank you, Mwalimu. This is the final question I'm pushing out to Tina. In the hierarchy of how you were born, firstborn, secondborn, thirdborn, the fourthborns, fifthborns, who have probably the high chances of experiencing child trauma? Maybe.
That's a difficult question, Dan, because people are different, but I'll try. Usually, from a psychological perspective, the middle child is seen as the most needy person in the family, because, and especially in African culture where we prioritize birth order and birth positions, the firstborn is special, the lastborn is special. So the middle child is in here without any unique characteristics to differentiate them. And when we say the firstborn is special, is that they are almost next to the parent in terms of family leadership, and the lastborn is the baby of the home, and that's special. And then you are here in the middle. No one even knows you, whether you are around, whether you are not around, it's the same. And from a parenting psychology, say give more importance to that middle child because they don't feel special in most cases. And this is why I said it depends with individual by individual. Of course, the middle child, even when you look at just like practical experiences, the middle child happens to be very competitive. They will do exceedingly above every other family member because they must be noticed. And also the negative energy and the negative vibes sometimes give them a lot of energy to focus on. They are on the right track most of the time. But they are emotionally hurt in most cases because they are not receiving as they should the attention, the appreciation, and even the emotional attachment is not there in most cases. So individual by individual cases, like people who have already identified themselves as the middle child and they know that there is that emotional gap that they are not receiving directly, especially for parents who are not self-aware of what they are doing, they are stable in that they have sorted it out psychologically. But it's still not in the safe zone because when it comes to romantic relationships, they may stand at a corner and feel like anyone who appreciates them is the right person, or anyone who is giving them that kind of love which they haven't received from home is also like part of their family, so they are rejecting it. Either way, there's that differences. Also, it's not like an automatic happening, which I've just cited. There are families that hate their firstborns. There are families that also hate their lastborn. So you see, it's different really. It's difficult to tell. Like this is the way it's going to run. But from a psychological point of view, and also where I stand, I would say give attention to the middle child.
Oh, okay. Firstborns, they have been kept packing. Wamewekwa packing kidogo. Anyway, let's get to a Q&A. I don't know if Julie is around, but before you leave, Tina, there is a question here. How do you manage triggers or flashbacks related to trauma?
Okay, the best thing to deal with triggers and flashbacks, if you're an adult and they're coming to you, or even to a child, is to get to the root cause. What is the cause of these flashbacks? Because if you treat the flashbacks, they will keep on reoccurring because you haven't dealt with the main cause. Okay, and the main cause is just good to see a specialist, a professional. They'll be able to do a better job than you. And if it's for an adult struggling with flashbacks and triggers of an event that happened in the past, I would recommend, some techniques for self-healing, but the most important and the most effective route is to go for counseling so that you can have a proper healing, So one of the techniques you can do for self-healing is to journal a lot, particularly on the root cause and on the triggers. It is not really healing, but it is externalized. You have brought it out. It is not hurting you inside. You have just put it out. You see? So journaling can help. These are just things you can do to manage the way you're feeling before you see a specialist. For me, I would really advocate just see a specialist, and a specialist, I mean see a counselor. Okay, so journaling, you can engage in self-care, where you are aware of the triggers and how they come, and so you avoid those places that will bring the trigger, people. But you see, this is not really functional, because it's just like living a life that you have cornered somewhere here and there, and probably you're not even happy while doing all that. But it helps. It helps to manage the triggers so that you don't have outbursts, neither are you very sad, you're just somewhere. The other thing I would talk about is prayer. I believe that healing comes from God, in as much as we are talking about professional counseling. The Bible tells us that it is God who binds the broken hearted. He binds the wounds. So wherever they are, for me, I would advocate for prayer. Pray about it. Take a verse over it, because sometimes those are also attacks of the enemy to diminish your life and make you, stay in a certain zone where you can always control you. So prayer can help, but at the same time, you need to verbalize. You need to talk to a person who can assist you through the process of healing.
Okay, I want to push this question from Delphine to Mr. Njenga. He said, there is a young man in Form 3 who is bedwetting, and I have learned that there are triggers. He is in day school, he has both parents, and the mother says they are a peaceful family. So she's asking, where do you start? Where do you find the X? What is the trigger? Is this young man probably undergoing through child trauma, or what is the issue? Is it just a biological, coming?
Thank you. I would want to maybe suggest to this parent that it is always very important to be close to a child. Be close to a child. Let the child let you learn from the child what they are going through every day of their lives. And if you're able to learn what they are going through every day of their life, maybe they are able to open up to you. And if they are not able to open up to you, then you can go through the friends. You could know of reliable friends to your child, your boy, and maybe the friends of the boy may be able to tell you what the boy is going through, because teenagers tend to be very confidential, but they open up to their colleagues. They open up to their fellow teenagers. And so if the child has blocked completely, and probably the child is not opening up, then you could try the channel of going through friends and trying to understand what the child goes through, what is the pattern of the child's life from maybe the moment the child enters school up to the time he's leaving, because teenagers can be very secretive. And the other thing that maybe I would want to ask the parent to find out is whether the child could in any way have involved themselves in gangs, because there are gangs that are prevalent among teenagers. Maybe the child has indulged in drugs. That's the other thing that may be troubling the child. The boy could also be in a relationship with the opposite sex, somebody of the opposite sex, and maybe the relationship has gone haywire, and the boy is disappointed, and all those kind of things. And so mainly I would want to suggest that maybe the parent needs to find out, is the child in an illegal gang, is the child in a relationship with the opposite sex that is not going well, and so that is maybe behaving that, or maybe the child is in drugs. If not, it could also be due to maybe grades in school are not going well. The grades are going down and down and down, and maybe they have very unpleasant experiences with teachers because of their the grades that are going down in school.
Oh, okay. I can see our time is probably up, and I just want to get a parting shot from Mr. Njenga. What is your parting shot about child trauma,
Yeah.
how to raise kids free from child trauma? What is your parting shot?
Thank you. I think what I would want to say is that because we're talking about children and trauma, the best way of dealing with it is prevention. Prevention is always better than cure. And therefore, for any young man that is looking forward to bring up children, I think it is important for them to get prepared well enough, well in advance, prepare and get to learn a little things about family, get to learn a little things about relationship, get to learn a little things about how to bring up children. And I remember there is this one man that was promised in the book of Judges. There is a man in Judges 13 that was called Manoah. And when he was told that you're going to get a very special child, he engaged the angel and said, please tell me before you leave, how shall I bring up this child because he is special? And that's a question that every person needs to ask, that now that I am looking forward to being a parent, how do I prepare? How are children brought up? And such a seminar like we have today and this discussion is very important so that we have prevention being better than cure. Other than dealing with trauma, we prevent it earlier before it occurs. Thank you.
Okay, Tina, what is your parting shot for our meeting today?
For me, I would say that, when you're preparing to become a parent or you're looking in the future to be a parent, we prepare so much in terms of how will I do it, a lot of appropriate knowledge, which is okay. But for me, I would advocate for any parent to go through counseling before you become a parent, or even when you are a parent, you also need personal healing. And the reason is because sick people make other people sick. You see that? So the level of trauma you detect in your life is going to make you sick, and in return, you find a lot of difficulties in wanting to do what is right. And even when you have the right information, you still you find it difficult to do what is right because there's something that is making you sick. So for me, I would say my parting shot, if you detect trauma in your life, find healing. And also, if you've gone through trauma, either from your parents or people close to you, just forgive. That's one part of healing. Forgive. They didn't know better. Now you know better. You can do better. Thank you.
Wow. Thank you. Thank you very much, Tina and Mr. Njenga. I believe we have learned one or two, three things. I was asking myself this question that now that I'm not married, I don't have kids, what do I do in terms of raising healthy children? I think it's Mr. Njenga has summed it all. But get ready, join the meetings, join the chamas, listen to what the couples are saying, get the wisdom, and I think it will be better. I'm talking this, Julia or Titus, whoever is ready, please. Now, finally, Tina has written a book. I don't know how they can get it. I know that Mr. Sammy has also said he has written a book. Please just tell us probably the name of the book and how we can get the book, and probably the audience that you have written the book to, as Titus and Julia do it in the next 2 minutes so that they can give us the announcements. Let's begin with Mr. Sammy.
Thank you. I said I have written and published 3 books. One is called Ignited, Answering the Youth Dilemma. It's directed in giving guidance to teenagers especially. Then I have written another book that's called Understanding Relationships. It's all about relationships from the time you begin loving to the time you get married. Takes you through a journey through all relationships. And the other one that I've written is called Woman, You Can Make a Difference. And that's addressing the Christian woman, how the Christian woman can make a difference. All the books are found in PDF. They're also found in hard copies, and they can be gotten through my, if anybody would want to get the books, they can call me. Maybe I can give the number,
Okay.
0723 933 822. That's my contact, and you can always get in contact with me. Thank you.
Okay, asante. Tina?
Thank you, Dan. I've written a book. I recently wrote a book on teenagers. It's called Uncovering the Secrets of Teenage Years. And you can get it from me, straight from me. That's my number over there. I also blog. Let me put in my blog here. I'm sure you can find something for your healing, if you're, or something just good enough to give you more information on whatever else you're striving to achieve in matters mental health. So I'll type it. I'll type it there, Dan. Thank you.
Okay, please. Someone, Julia, you can get the contacts for us. Post them in the group so that anyone who needs the books can have them. Finally, Julia, whoever is around, Titus, please give us the announcements and then we can close the meeting. We are past 4 minutes.
Thank you very much, Dan. First of all, we want to thank our panelists, Mr. Njenga and Madam Tina, for the wonderful session that they've brought to us. We have learned a lot, and we thank you for that. God bless you. Our announcement is that we still have our monthly meeting. So let us, as members, let us continue sharing our meetings to even other people so that at least we can bring more people on board. We are also planning for a goat eating for all of us, which will be on 10th September. That is in 2 months' time. We are requesting all of us to purpose to attend. This is an event that you don't want to miss. More updates will follow on our WhatsApp group so that we can keep you posted on the plan and everything. Thank you.
Okay, Asante. I want us to close the meeting, but before that, please, Moffat, prepare to have our ending prayer. Hey, where is Julia? Julia, Lucy, you need to get the books from Mr. Sammy. Hiyo tafadhali tafutana na Mr. Sammy, mutafute hizo vitabu. Especially woman, you can make it. Please, I'll follow up on that. Titus and Moffat, tafadhali mutafute kitabu ya Tina. It will really help you a lot. I'll also follow up on that. Thank you very much, Tina, and thank you very much, Mr. Njenga, for sparing your time for such a meeting. We are grateful, and we trust that anytime we'll ever need you for the meeting, you'll be found. Now, I want to welcome Moffat. Moffat is still around. Moffat. Okay. I'm looking for Moffat. Yes, Moffat. Moffat is one of our senior associates, and kindly close with a word of prayer.
Thank you so much for the good work. Thank you, Madam Tina and Sammy. We are so grateful for that session. It has been very enlightening. Mungu azidi kuwabariki na kila mmoja ambaye anajiandaa kuwa parent na wale tuko ma parents. God continue helping us so that we may raise a godly generation for God in Jesus' name. I think we can just pray. Our Father and our God, in Jesus' name, we are so grateful to you, Father, for the time that, Lord, you've given unto us. Seeing that, Lord, we have had meaningful discussions on how to bring up children in traumatic times, oh God. Indeed, Father, we pray that you may continue guiding us and helping us in all things, in matters bringing up our children to avoid such things as trauma, so God, and where they could have affected our children, give us the wisdom to really restore them and to give them faith and the confidence that, Lord, you work out all things for good. In the name of Jesus. And for those of us who may not have yet married, Lord, I pray that you may continue adding them wisdom so that with the wisdom they can mitigate some of those things that could lead children to trauma by good preparation and knowledge of God. We thank you for this night, Lord. We pray that your presence be together with us and that every plan that we have, God, may your presence, O God Almighty, go ahead of us and make a way for us. We are grateful to you. And it is in thy loving name and the loving name of thy Son, our Lord and our Savior, Jesus Christ, we pray and give thanks.
Amen.
Amen.
Amen. Thank you for attending. God bless you.